second speaker, who is also the founder of Daily Wage Worker Platform, Siddhartha Prakash. Siddharth has, like, all of you know, he is the the person who got all of us together. He's the thread which is connecting all of us, including a lot behind this webinar as well. So the Daily Wage Worker platform under Siddharth's leadership has developed a vaccine survey report, and it has some very important and interesting findings. So over to you, Siddharth. We would love to know, what this report is all about in India. Over to you.
Thank you, Priyanka. Deepak, if you can share the slides. So a little bit about us, the Daily Wage Worker Platform. It's been focusing for the last almost 2 years on providing migrants with food security, healthcare, livelihoods. And we know about all the problems that the migrants particularly faced during the whole lockdown episodes. And that actually gave rise to the concept of doing this survey to really understand how these mobile populations are actually being impacted by the whole vaccine process. Are they getting vaccinated? Are they resistant to it? And what's happening to them on the ground? Because they could also, and they are spreading it, going from urban to rural to urban areas. So next slide. Yes. So basically, we did a survey which was done by Daily Wage Worker Platform, Jindal Global University, and we covered 200 migrants across 6 cities, which you see here: Gurgaon, Delhi, Bombay, Calcutta, Ranchi, and Chennai. This was essentially a dipstick survey using convenience sampling, where we measured both levels of vaccine adoption by the workers and resistance. Respondents were asked a set of questions to understand the underlying causes for vaccine adoption and resistance. So it was a big socioeconomic survey. We looked at different age, income, gender, sex, and what are the cultural and socioeconomic influences that are impacting these people. Next slide. So these are the key findings. So as we see, I think the good news is that 44% have received the first dose, 18% have received the second as of October this year. This was. But 38% remain unvaccinated, 18% were hesitant, 12% were resistant. And then I think what's really important here to understand is, where are they getting their information from? So 94% are getting it through word of mouth from, their local communities and people. And 72%, said that the side effects were the key barrier to actually taking the vaccine. But 80% did believe that it was a good preventive measure. Next slide. And here we see, by household income, so we can actually see that, people generally with higher incomes, more permanent, stable jobs are less resistant to the vaccine versus daily wage workers who are on the streets, in the informal sector with less access to a stable income, information, access even to the vaccines, who tend to be more resistant. Next slide, please. And here, I think this is important to really highlight, because we're talking about, how do we use communications ultimately to reach out to these communities, inform them, and reduce the level of resistance. So 94%, as I said, are getting the information from word of mouth, 55% from social media, 54% from TV, 52% from religious leaders and healthcare professionals. So that's an important I think sequence of influencers, so we should see how we use them productively. Then comes newspapers, radios, and the village leaders and panchayats. Next slide. So what are the factors promoting vaccine adoption? As we said, migrants with fixed income were willing and semi-vaccinated already. But the real reasons that this is a city survey, so it was done in 6 cities. We don't know too much about what's happening and the resistance levels in the rural areas. But from what we do know is that many public and private sector employers are actively facilitating the vaccination process. This includes construction companies, railways, and other things, which are making it mandatory for their workers to get vaccinated, so they can only come to the work facility if they are vaccinated. And that is a huge economic incentive to getting vaccinated, and that's actually working. The government is also putting pressure on workers to get vaccinated through communication and other means. So I think that's a good thing. And I think what's really important here is to see that, if we can actually achieve in such a short time frame over the last 1 year, to get these people vaccinated, then you can equally use that same impetus and methodology and infrastructure to provide them with all the other socioeconomic benefits that they are currently lacking today as daily wage workers being impacted by the COVID-19 pandemic. Next slide, please. So then we look at, what were the factors that are causing this resistance? And it's interesting because I think in Europe, people are looking more from a rights perspective and saying we should have the right to choice. We should be questioning, the scientific efficacy and so forth of the vaccine. I think here the dynamics are slightly different. So the first thing is that, daily wage workers earning less than 10,000 per month were the most resistant. And the reasons were many were ignorant, suspicious, resistant to the vaccine. And the reasons really were, there were fear of side effects. Some people, thought that they'll be impotent, they could be pork in these vaccines, and all kinds of rumors have been spread. A lot of people felt that there'd be loss of wages in case they got sick or had to go and take a day off to get vaccinated. As we saw, from the earlier speaker, there's distrust even in India in the public health systems for various reasons. And also lack of information. So while some information is getting out there, there's a lot of, I think, contradictory information that is also prevailing, which may actually drive people from, pro to resisting vaccines. There are also challenges with the access issues in terms of availability. In India, you have to download the Arogya Setu app, and I think some of the workers were facing challenges doing that and then getting to the next stage of actually getting vaccinated. As we mentioned, the channels of communication, I think, are important. So respondents who received most of the information from community leaders or panchayats reported greater hesitancy to the vaccine. So, we had cases where in certain villages, one or two of the leaders got vaccinated and they had unfortunate deaths in the family as a result of that. And that kind of spread a lot of fear very quickly, and entire communities overnight said, if our leaders are dying from this vaccine, which again, we don't really know that that was the cause, none of us are going to have the vaccine. So I think this kind of, fear mongering, particularly in rural India where access to information is remote and the healthcare facilities are not at their best, it really needs to be taken on full on. Next slide, please. So our recommendations based on this diptych survey are that everybody has a role to play. The governments need to communicate and explain the benefits of vaccines to enhance public trust in the COVID-19 vaccine, that they are safe. Also put forward, I think people do know already, what are the economic consequences? Like we're seeing new waves coming, more lockdowns coming, loss of income, and the economy going down. So then really saying that these vaccines are safe and effectively, and they need to also be delivered in such a way so there is trust. And also we need to prioritize the mobile workforce, because I think initially, obviously, as was done globally, they looked at the elderly, they looked at frontline health workers and things, but these are mobile workforces, and there are large sections, almost 400 million people who move around quite a lot and end up being super spreaders. So they need to be prioritized, they need to be targeted, and they need to be vaccinated. And establish a robust information system. Civil society is playing a role, as we're seeing from the presentations, so they can help bridge the technological economic gaps, be the authorities' eyes and ears on the ground, because I think, vaccinating 1.3 billion people is not an easy task for any country or government. So we do need the civil society, employers, and everybody to work together. And I think, this is a very important role for our partners to play, but then I think the government also can sort of enable some of our partners to actually do work and reach out to areas and populations where they are struggling to do. And then also target community leaders and local mediums of information, because every community is different. They have their own socioeconomic leaders and people they depend on, people they listen to, empowering those people to be the sort of brand ambassadors, I think is very important, and take the vaccine to the people through camps and drives. So, have drive-ins, have schools, and local marketplaces where the vaccine can be implemented easily and in an open, transparent manner so people see people getting vaccinated. That itself, I think, allays a lot of fears and will reduce resistance as people get trust and see the importance of doing this. Employers should continue to incentivize employees to get vaccinated, facilitate that process, support them to do it, and then work with labor unions, authorities to increase vaccine acceptance. And I think the biggest challenge really, as we've seen, is with the daily wage workers, how do we reach out to them? How do we create that sense of trust and have some impact on the ground, which we'll be, I think, hearing from our next speakers. Thank you.
Thanks a lot, Siddharth. Very interesting findings and very robust and practical recommendations for all three sectors, at least, from my perspective. But like you rightly pointed out, it's very difficult with daily wage workers. A lot of people in India, there was obviously vaccine hesitancy here as well. I had some people, especially from, my domestic helps, their spouses and families, they're like, oh, we're scared of getting side effects. They were scared of getting fever because nobody was talking to them. But then eventually they started getting it in big cities because their employer, like I would be like, get your vaccine, otherwise I, stay on leave. So a lot of people got it due to that. But like you said, daily wage workers, people go sometimes to work for a few hours, 10 days, 20 days. And a lot of times, because they don't have a regular standard employer, nobody is incentivizing them. And in the beginning, especially in India, because underprivileged people, a lot of them may not be educated. So it was also difficult to find vaccine slots. A lot of my friends helped their helps. A lot of employers organized it in their offices and their factories. But for a lot of them, they were clueless unless and until the online vaccination system actually went away and they could actually walk in. Till then, it was complicated for them and for daily wage workers even more.